Good evening, medicos. Welcome back to our channel, Medical Students Corner. Myself, Dr. Krishneswari. So, we were discussing about the symptoms of neurology. As all of you know, we discussed about 4 symptoms in neurology, and in this fine day, we are going to a new symptom in neurology. Any guess? The symptom is syncope. Okay, syncope. So, syncope, it is a syncope is something complex. So it has a complex mechanism to understand. There are so many types of syncope. So in order to make this complex into simple matter, you have to have some basic anatomy and physiology, regarding some basics regarding the autonomic nervous system. You may be knowing everything about autonomic nervous system, but for better understanding, we should refresh the things what we know. Is it not? So today in this session, we are going to the basics of autonomic nervous system. Okay. So autonomic nervous system, it is the nervous system in our body which controls the visceral organs in our body. So it is concerned with involuntary activities. Okay, what is involuntary activity? What we are not aware, suppose respiration, digestion, is it not? Heartbeat, we are not aware, we cannot say respiration stop, like that we cannot say. Heartbeat please stop, like that we cannot say. It will be from birth, not from birth. From the womb itself it is happening, heartbeat is happening. From the birth itself, breathing is happening. So we cannot control that. It is under the control of autonomic nervous system. So all the involuntary activities are under the control of autonomic nervous system. So it is also known as involuntary nervous system since it controls the involuntary activities of the body. Okay, this autonomic nervous system, it is divided into 2. One is sympathetic nervous system and the other is parasympathetic nervous system. So sympathetic and second is parasympathetic nervous system. Something opposite. Okay, sympathetic and parasympathetic will be working in an opposite manner. Sympathetic and parasympathetic nervous system. See, the most important thing what you have to understand is sympathetic is in relation to our emotions. Okay, in relation to our emotions. So, sympathetic activation is also known as flight and fright activation. So it gets activated, sympathetic nervous system gets activated during our flight and fright response. Okay, so when there is fear or when there is a situation where we should escape, our sympathetic nervous system will come into action, and this parasympathetic nervous system, which is opposite to the action of sympathetic nervous system, it will get activated during what? Rest and digest. It get activated during rest and digestion, that is when we are relaxed without any fear. So this parasympathetic activities will come into action. So this parasympathetic activities will come into action in sweet emotions like when we are in love or something like that, what we enjoy. So their parasympathetic activation will come into action, and when we are irritable, when we are very fearful, we are very restless and all, our sympathetic activities will be coming into play. You understand? This is something basic. When you hear about parasympathetic, you should be thinking of relaxation. When you hear sympathetic, you think it is flight and fright. You understand? Okay, so we will see the codes of the sympathetic and parasympathetic nervous system. So the sympathetic nervous system, it is also known as thoracolumbar outflow. Okay, thoracolumbar outflow. And this parasympathetic nervous system is known as craniosacral outflow. From the name itself, from these words itself, you understand it is something in relation with thoracic and lumbar spinal cord, and parasympathetic, there is something in relation with brain and also in the sacral section of the spinal cord. Okay, we will see in detail, not very detailed, very short things I am going to say. Just to refresh, what about the autonomic nervous system. If we are knowing the basics of everything before studying, then it will be easy for us to understand everything in a very clear manner. Okay. So, first I will be saying something about sympathetic nervous system, then something about parasympathetic nervous system, and then we will compare parasympathetic and sympathetic. Then it will be easy for you and it will be getting registered in your brain. Okay. Recall, registration, everything in relation to memory. So, we are discussing about neurology, everything in relation to higher mental functions. Okay. So, sympathetic. First, we told that it is the thoracolumbar outflow, is it not? So, suppose this is the brain. You think that this is brain, okay? And this is what? Brain stem. Midbrain, pons, medulla. Okay, midbrain, pons, medulla. And the continuation of medulla is spinal cord. This is cervical segment, thoracic segment, lumbar segment, sacral segment, and this is coccyx. Okay. So, for better understanding, I am drawing this. So, we told that the sympathetic nervous system, it is known as thoracolumbar outflow, because this sympathetic nervous system, the ganglionic fibers or preganglionic neurons are situated in the 12 thoracic spinal cord segments and also first 2 lumbar segments, that is sympathetic nervous system, the neurons, the preganglionic neurons are situated from T1 to L2. Okay, T1 to L2. That is 12 segments of thoracic spinal cord and first 2 segments of lumbar spinal cord. So, T1 to L2. So, we will see the course of the sympathetic nervous system. So, this is spinal cord. This is spinal cord. This is the grey matter. This is the grey matter, and this is the posterior part. This is the anterior part, and this is the lateral part. Okay, posterior part, it is always concerned with sensation. Anterior part, it is always concerned with motor. And what about lateral part? Is lateral part, it is concerned with the autonomic nervous system, that is the sympathetic neurons, preganglionic neurons is situated in the lateral horn cells of T1 to L2. Understand? So, from the preganglionic neurons, preganglionic fibers arises. So, from the preganglionic neurons, preganglionic fibers arises, and it is, please listen carefully, and it is travelled along with the motor neurons in the anterior horn of the grey matter. Along with the motor neurons, it comes outside and gets synapse with the ganglia or ganglion. Okay, gets synapse with the ganglion. So, what is ganglion? What is ganglion? Any answers? Any guess? Okay, ganglion are the group of nerve cell bodies or collection of nerve cell bodies outside the CNS. Okay, inside the CNS we have discussed about nucleus. Now, the first part of what? Weakness and paralysis we have discussed. If you have any doubt regarding nucleus, please go through that session. So, ganglia, it is the collection of nerve cell bodies outside the CNS. Inside the CNS is nucleus, and it gets synapse in the ganglia outside the spinal cord. Then what happens is, from the ganglia, postganglionic fibers arises. Okay, and it will be supplying the structures. Okay, it will be supplying the visceral organs. Visceral organs may be, sometimes it may be pupil, sometimes it may be heart, sometimes it may be what? Lungs, sometimes it may be adrenal gland. So many internal organs it will be supplying. So we will be discussing it in detail. So this is about the course of the sympathetic nerve fiber. So the preganglionic neurons, it is situated in the lateral gray horns. From there preganglionic fibers arises along with the motor nerve through the anterior gray horn. What happens? It will be traveling outside and it gets synapsed in the ganglia outside the spinal cord. From the ganglia, what post-ganglionic fibers arises and it will be supplying the structures outside. You understand? So from here the thing happens and also there will be ganglia, and from the ganglia it will be supplying the structures. So what about the thing in parasympathetic system? We will see. So in the parasympathetic system, the preganglionic fibers, it will be arising from the cranium, that is 4 cranial nerves. It is not 4th cranial nerve, from 4 cranial nerve and also from the sacral segments. It is known as, parasympathetic is also known as craniosacral outflow. Craniosacral outflow from the cranium, that is from the cranial nerves. Which cranial nerves? First is 3rd cranial nerve. 3rd is oculomotor nerve. 3rd, 7th. 7th cranial nerve is facial nerve. 3. Then 9th cranial nerve is glossopharyngeal. And 4th is the vagus. 10th cranial nerve is the vagus. Okay. From these 4 cranial nerves, the neurons or preganglionic fibers arises, and also from the sacral segments S1, S2 and S3. From the 3 sacral segments and from the cranial nerves, that is 3rd, 7, 9 and 10 cranial nerves, that is 4 cranial nerves, the fibers of the parasympathetic system arises. Understand? So you have a deep understanding about this system. So the ganglia of sympathetic nervous system is divided into three, that is paravertebral, prevertebral and also terminal ganglia. So this paravertebral ganglia, the importance is that this paravertebral ganglia, which is in close relation with the vertebral column, it's what runs along the vertebral column. It starts from the skull. It starts from the skull and ends in the coccyx. Okay. Throughout the vertebral column, the paravertebral ganglia. So it is the ganglia of the sympathetic nervous system. It is divided into 3: paravertebral, prevertebral and also terminal ganglia. Paravertebral, prevertebral and terminal ganglia. This paravertebral ganglia, it is in close relation with the vertebral column or spinal segments. It runs along with the vertebral column and it forms sympathetic chain. This is very, very important. Sympathetic chain. Okay, sympathetic chain. What is sympathetic chain? All the ganglia of the sympathetic nervous system fuse together to form a chain, and it is known as sympathetic chain. And this prevertebral ganglia, it is in close relation with the aorta. It is situated inside the thorax and abdomen and it is in close relation with the aorta. And this terminal ganglia, it is in close relation with the organs where this sympathetic fibers supply. You understand? Close relation where the sympathetic fibers supply. Okay, this is about the sympathetic ganglia, and there is nothing more to say about parasympathetic ganglia and all. So the sympathetic chain, it is the paravertebral ganglia. Okay, they are connected by means of a chain like matter, that is connected they are connected one another and it forms a chain like structure and it is known as sympathetic chain. So we will see the difference between sympathetic and parasympathetic nervous system. First, suppose in sympathetic and this is parasympathetic. First is this preganglionic fibers will be short. Preganglionic fibers will be short and postganglionic fibers will be long. Understand? Preganglionic fibers will be short and postganglionic fibers will be long. But in case of parasympathetic nervous system, this preganglionic fibers will be long and postganglionic fibers will be short. That means it is more nearer to the organ. Understand? This ganglia will be more near to the target organ. But here the ganglia will be near to the vertebral column, near the spinal cord. You understand? So, in sympathetic nervous system, preganglionic fibers is short and postganglionic fibers is long. But in parasympathetic nervous system, preganglionic fibers is long and postganglionic fibers is short. 2. About the neurotransmitters. So, in the sympathetic nervous system, there are two neurotransmitters acting. One is acetylcholine and second is catecholamines. Acetylcholine and catecholamines. In sympathetic nervous system, there are two neurotransmitters. One is acetylcholine and second is catecholamine. In the parasympathetic nervous system, there is only one neurotransmitters, that is acetylcholine. Understand? Acetylcholine. Then about the sympathetic nervous system, ganglionic fibers, preganglionic fibers, the neurotransmitter will be acetylcholine, and also in parasympathetic preganglionic neurotransmitter will be acetylcholine. You understand? So, both in sympathetic and parasympathetic nervous system, the preganglionic neurotransmitter will be acetylcholine, but in postganglionic neurotransmitter in case of sympathetic nervous system is acetylcholine and catecholamines. Okay, acetylcholine and catecholamines, postganglionic neurotransmitter. But in case of parasympathetic, postganglionic is also acetylcholine. Postganglionic is also acetylcholine. So, there is only one neurotransmitter in case of parasympathetic. But in case of sympathetic, there are two postganglionic neurotransmitters. Okay, you understand. Regarding the receptors of this autonomic nervous system, there are two types of receptors. Okay, two types of receptors. One is cholinergic receptors and second is adrenergic receptors. Cholinergic and adrenergic receptors. Cholinergic receptors, it is in relation with the acetylcholine, and adrenergic is in relation with the catecholamines. Okay, so what is catecholamines? I was repeatedly saying catecholamines. Where we will be hearing about catecholamines? It is in endocrinology. It is in relation with the adrenal gland, is it not? Adrenal gland secretes catecholamines, that is adrenaline and noradrenaline. Okay, so these are the two receptors. So regarding the cholinergic receptors, there are two things we should understand. One is cholinergic. Okay, regarding the cholinergic receptors, we should understand two things. One is muscarinic receptors and second is nicotinic receptors. Muscarinic, this is for just understanding I am saying. If you are understanding more and more about anatomy, more and more about the physiology, then you will feel that PM is the most easiest subject. Medicine is the most easiest subject. So you should have a basement for everything. Then it will be very, very easy. Just for the basement, I am talking like this. Okay. Any doubts, you can comment me. Okay. You can ask me in the comment box. So, muscarinic receptors and nicotinic receptors. And this nicotinic receptors, it will be seen in between the preganglionic and postganglionic fibers. Okay, preganglionic and postganglionic fibers. That is the first part where preganglion forms synapse with the postganglionic fibers. This nicotinic receptors will be there. And this muscarinic receptors, it is seen in the postganglionic fibers of parasympathetic nervous system and also cholinergic fibers of the postganglionic fibers of sympathetic nervous system. Understand? So this nicotinic, it is only seen in between the preganglionic and postganglionic nerve fibers, and muscarinic receptors, it is seen in between the postganglionic fibers of the parasympathetic nervous system and also cholinergic fibers of the postganglionic fibers of the sympathetic nervous system. You understand? Next, what about adrenergic receptors? So these adrenergic receptors, it is responsible for the catecholamines, is it not? So adrenergic receptors, there are two types of adrenergic receptors, alpha and beta. Okay, alpha and beta. And this alpha receptors, it is it is more responsible for the conduct of noradrenaline, transmission of noradrenaline. And this beta receptors, alpha is divided into alpha 1 and alpha 2. Okay, alpha 1 and alpha 2, it is more and more details, you just understand. Alpha receptors and beta receptors, both alpha 1 and alpha 2, it is responsible for the conduction of noradrenaline. And beta receptors, it is again divided into beta 1 and beta 2. Beta 1 will conduct both adrenaline and noradrenaline, both adrenaline and noradrenaline, and beta 2, it is more responsible for the transmission of adrenaline. Okay, this is about the receptors. You are confused? No. I will say once more. There are two types. There are two types of receptors. One is cholinergic and second is adrenergic. Cholinergic, it is responsible for acetylcholine, and adrenergic, it is responsible for catecholamines. Catecholamines, they are the hormones produced from the adrenal gland. Then this cholinergic receptors, it is divided into two, nicotinic receptors and muscarinic receptors. Nicotinic receptors, it is seen in between the preganglionic and postganglionic fibers. Muscarinic receptors, it is in the postganglionic of parasympathetic nervous system and also cholinergic fibers in the postganglionic fibers of sympathetic nervous system. And adrenalic receptors, it is divided into alpha and beta. You remember like that, alpha, beta, you forget alpha 1, alpha 2, beta 1, beta 2. Alpha, it is more responsible for noradrenaline. Beta, it will be conducting both adrenaline and noradrenaline. Okay. So this is about the receptors. Okay. Then we will go to the functions of the sympathetic and parasympathetic nervous system. Okay. It is very, very easy. They are antagonistic in function. What the sympathetic nervous system will do, parasympathetic will not do. Okay. So, sympathetic and parasympathetic nervous system functions we are going to discuss. So, starting from the face till the urinary bladder, we will be discussing. Okay. So, face, what is the involuntary action taking place in the face? So, pupil, is it not? Pupil. So, in case of sympathetic and parasympathetic nervous system, so first pupil, we will draw with different colors. Okay. So, think that this is eye. Okay. Eye. So, in case of sympathetic and parasympathetic. So, in case of eye, the sympathetic nervous system, we all know that the sympathetic nervous system is concerned with the flight and fight response, is it not? So, when we are fearful, what we will do? Our pupils will dilate, is it not? Our pupil will dilate. So, this sympathetic nervous system, it is responsible for the dilatation of pupil. Okay, dilatation of pupil. And parasympathetic, it is responsible for, dilatation means next is constriction of pupil. So, when we are in rest, when we are happy, when we are easygoing, when we are relaxed, our pupil will be constricted. So parasympathetic nervous system is responsible for the constriction of the pupil. And when we are frightened, when we are having emotions, fearful emotions, our pupil will dilate. So sympathetic nervous system, pupil will dilate, and parasympathetic nervous system will constrict the pupil. Okay. Next organ what we are going to discuss is lacrimal gland. Lacrimal gland. So tears. Okay. Lacrimal gland. So in lacrimal gland what happens, and in case of parasympathetic nervous system what happens is there will be increased secretion. Tears, സന്തോഷം കൊണ്ട് കണ്ണ് നിറഞ്ഞു എന്ന് നമ്മൾ കേൾക്കില്ലേ, ദാറ്റ് ഈസ് പാരാസിമ്പത്തറ്റിക്. വെൻ യു ആർ ഫ്രീ, റിലാക്സ്ഡ്, ഹാപ്പി, വി ആർ ഇൻ ലവ്, വാട്ട് ഹാപ്പൻസ്? ഇൻക്രീസ്ഡ് സെക്രീഷൻ. ആൻഡ് സിമ്പത്തറ്റിക്, when we are frightened, we will be what we will do, we will be making so much of noises, ayyo odi varne rakshikane and all. So the tears will not come. We are frightened, is it not? So we will be running rather than crying. So what happens in case of sympathetic nervous system, when we are frightened, there will be reduced secretion. Okay, reduced secretion. And parasympathetic nervous system, there will be increased secretion. Next is salivary glands. We'll use this, okay. Salivary glands. So you remember about confusion and delirium now, okay. So in case of salivary glands, suppose you guys, we are going for an interview or we are going for viva. What happens? We are going, sitting in front of the examiner. So what happens? He is looking and smiling at us. We are also smiling, but what happens? Our mouth will be dry, is it not? Due to fear, our mouth will be dry. We cannot talk. We thought there is thirst, there will be dryness of mouth, there is dryness of what? Throat also. So in case of salivary glands, there will be reduced secretion. In case of sympathetic nervous system. In case of parasympathetic nervous system, we are happy, we are having a chicken biryani in front of us, we are very happy, we are relaxed. What happens? There will be more secretion of saliva, is it not? So in parasympathetic nervous system, the secretion of saliva will be increased. You understand what I am meant to say? So the examples for just understanding I am saying. So you just remember like that. You don't go and muck up everything. Oh, sympathetic, parasympathetic, increased, decreased. You cannot study. So you just understand and study. Okay. So in case of salivary gland, there will be in sympathetic, there will be reduced secretion. You remember our viva. And in parasympathetic, you remember chicken biryani. And there will be increased secretion of saliva. Okay. Then next is GIT. We are going to discuss about GIT. So in case of GIT, what happens? We are tensed, we are frightened, you are getting 10 ladus. What you will do? You will not eat, is it not? So motility will be reduced, motility of the intestine will be reduced, the secretion of enzymes will be reduced. Okay, and also in case of what? Sphincters in relation to GIT, there will be constriction of the sphincters. Okay, so reduced motility, reduced secretion and constriction of sphincters. Okay, constriction of sphincters. And in case of parasympathetic, you are very happy, you are relaxed, you are happily sitting, enjoying the music you love. You are getting 10 laddu. What you will do? You start eating, is it not? With very much happiness, you will be start eating because your parasympathetic system is acting there, is it not? So the motility will be increased, the secretion of enzymes will be increased, and also the sphincter will be relaxed. You understand the difference? Both are antagonistic. They are acting opposite. They are acting in opposite. So next, after GIT, we will discuss about the heart. Okay. You think that this is heart, okay? Heart. So in heart, sympathetic, we are going for Viva, or else we will think like this, we are going, we are walking lonely in a road, a big elephant is big and it came towards, it was coming towards us, what we will do? Suddenly our heart will start beating, tap, 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 tap. The elephant can hear, is it not, how our heart is beating. So what happens? The heart rate increases in case of sympathetic nervous system, it will be increasing the heart rate. Okay, and in case of parasympathetic nervous system heart rate, it will be reducing the heart rate. Okay, so sympathetic nervous system heart, it will be increasing the heart rate, and in parasympathetic nervous system will be relaxed, and hence the heart rate will be reduced. Okay, next, regarding the gallbladder. So gallbladder, regarding the gallbladder, so we will write here gallbladder. So regarding the gallbladder, what happens is, in case of sympathetic nervous system, what the secretion will be reducing, the motility will be reducing, and so what happens? The gallbladder will be relaxed. Gallbladder will be relaxed in case of what? Sympathetic nervous system. But in case of parasympathetic nervous system, since we are eating so much, we are happy, we will be eating so much, motility will be increased, secretion will be increased, and the gallbladder will be constricted. Gallbladder will be constricted. Understand? So this is regarding the gallbladder. Next regarding the sweat gland. Sweat gland. So, sweat gland, again we are going for Viva. What happens? We will be feeling thirst. Means what? The secretions will be reduced, but we will be having profuse sweating. Is it not? Like what we feel, as if after coming from Viva, what we feel like we have bathed. Is it not? So, there will be profuse sweating in case of sweat gland. Okay, in case of sympathetic nervous system, when sympathetic nervous system gets activated during fight and flight, what happens? Sweat gland, the increased secretion of sweat will be there. And in case of, very important, in case of parasympathetic nervous system, it has no action on sweat glands. Okay, you should not say sweat will be reduced. There is no action of parasympathetic nervous system in sweat glands. Very important. Okay, so we are talking about the antagonistic functions. So you should not be confusing this with the sweat glands, action on sweat glands of sympathetic and parasympathetic nervous system. In sympathetic nervous system, sweat secretion will be increased, but in parasympathetic nervous system, there is no action. Next, we are going to talk about the blood vessels. Okay, blood vessels. So, in case of blood vessels, there will be constriction of all the blood vessels except blood vessel of the heart and the skeletal muscle. Okay, except the blood vessel of the heart and skeletal muscle, there will be constriction. Why? Fight and flight. So, fight and flight, what we will be doing? If we are seeing a snake in front of us, a big cobra in front of us, what we will do? We will be flying like anything, is it not? So, in order to get more oxygen to the skeletal muscles, what happens? There should be vasodilatation, and also heart should work more, is it not? For more force, heart rate should be increased. So, what happens? Cardiac output should be increased. So, more blood vessels of the heart and the skeletal muscles will be dilated, and all the others will be constricted. So, if we are in fear, suppose, what we will be feeling? We will be having what? When we touch us, or we will be feeling chilliness, we will be feeling chilliness of the fingers. Why? There will be vasoconstriction. But the most important thing is, in skeletal muscle and heart, there will be vasodilatation. Okay, except it will be inducing vasoconstriction except blood vessels of the skeletal muscles and heart. In case of parasympathetic nervous system, there will be vasodilatation. Okay, vasodilatation, understand. So these are some important things you should remember regarding the parasympathetic in sweat glands. There is no action. The sympathetic nervous system will be producing vasoconstriction except skeletal muscles and heart. Okay, next about the urinary bladder. Urinary bladder. So in urinary bladder, sympathetic nervous system will be producing what? Constriction of sphincters. Okay, constriction of sphincters and relaxation of detrusor muscle. Relaxation of detrusor muscle. Okay, constriction of the sphincter and relaxation of the detrusor muscles. But in case of parasympathetic nervous system, there will be in opposite, relaxation of sphincter. Okay, relaxation of sphincter and constriction of detrusor muscle. Relaxation of sphincter and constriction of detrusor muscle will be there regarding the urinary bladder. So these are the most important things in relation with the function of sympathetic and parasympathetic nervous system. You understand? So they are antagonistic in function. So the important things you should remember, when you are having a emotion like fear, your sympathetic nervous system will be acting, and you are in a relaxed state, the parasympathetic nervous system will be acting. Simple. You understand? Sympathetic and functions of sympathetic and parasympathetic nervous system. So these are the basic things you should understand in case of autonomic nervous system. So if you know all these things, it will be very, very easy for you to understand about the syncope and all other things. They are interrelated. In neurology, everything and anything is interrelated. So you should be having basics. Okay. So hope this class is useful for you. You had a refreshment of what you have learned earlier. So you are supporting me so much. Thank you for your support. So if you find my classes, my sessions useful, please subscribe, please share. We'll meet with syncope next time. Thank you so much.